Good morning. Welcome to Grand Rounds this morning. To receive CME credit, please navigate to the website and enter the code that will appear in the chat box. So feedback is critical to not only education, but also to our daily interactions with colleagues, managers, and pretty much everyone we come in contact with. But it's not a skill that we are born with or that we are necessarily comfortable with. Therefore, it is important to develop our skills in giving feedback. For that reason, I want to welcome an expert to help us become better at giving and receiving feedback for this Grand Round session. Dr. Lisa Bernstein is a professor of medicine in the Division of General Internal Medicine at Grady Memorial Hospital. She's the course director of the Clinical Skills curriculum and is a society advisor in the School of Medicine. Dr. Bernstein has dedicated her career to teaching all levels of learners, from medical students to faculty, to me when I was a resident, and has been recognized for her teachings at Emory, winning the Dean's Teaching Award 3 times, as well as the Evangeline Papa George Distinguished Teaching Award, which is the highest award bestowed by the School of Medicine. She was also the inaugural School of Medicine recipient of the Provost Distinguished Teaching Award and has received the Herbert Waxman Award for Outstanding Medical Student Educator from the National College of Physicians. Welcome, Lisa.
Thank you, Martha. I really appreciate that introduction, and it's gonna, it sets me up only to fall short of all those kudos. I want to thank you all for having me here today. Thank you all for what you do at Winship as my colleagues and consultants. And you know, as Martha said, I am clinically based down at Grady, so I get to teach medical students and residents both in the inpatient and outpatient setting. And I also have the great joy of being a small group advisor and the course director of clinical skills for the medical school. So I get to interact with our wonderful medical students all the time. And so really my interest in this topic was born out by my complete fear of having to give constructive feedback to people as I was on the wards. You know, all of us have gone through training and have been at the top of what we do. And to have somebody tell you that you're not quite perfect is really a hard thing, not only for the recipient, but you wouldn't imagine until you're in the hot seat. It's really hard for us, right, as the people who have to give feedback, even if it's just a minor constructive comment. So this is something that I became interested in because I wanted to conquer that fear. And Mike Greenwald from the Department of Pediatric Emergency Medicine and I give this talk in more of a workshop format. So the first thing you're going to notice is, even though this is billed as a grand rounds, this is not going to be your typical grand rounds with a lot of you know, scientific documentation to everything we're doing. A lot of this comes from literature, both in teaching and in business. And so this is going to be a very practical approach to how you can provide feedback to your learners. And we're going to specifically be using a coaching paradigm, trying to help our learners in a way that coaches do when they're training their athletes. And so we're going to make this very interactive as much as we can in this particular format. So I encourage you to use the chat function, especially when I open up for discussion. Please help me out this morning. I know it's early, but it's going to be much more fun if I can play off of what you guys think as well. And so we're going to get started. I have absolutely nothing to disclose. And we're going to talk today about a few things. One is the difference between formative and summative feedback. Some of you may be familiar with these terms and some of this may be new, so we'll talk about that. I'm going to give you some key components to giving effective feedback. And then we're going to talk about specifically the coach's approach and how we can overcome some of our fears in providing feedback to our learners. So I'm going to give you an example of a real life dilemma. And this is 100% true. I was an early attending at Grady and I was starting on the wards, and I really don't like getting a lot of advanced knowledge of who I'm working with because I don't want to develop a preconceived notion of, you know, what's going on. But I had already heard through the grapevine that the person I was supposed to work with as my resident running the team was a little difficult and had been determined so in the outpatient setting and the inpatient setting, and had just been lambasted on all of their evaluations. And so I went in a little guarded, but I can pretty much get along well with anybody. And so I was like, no, this is going to be fine. And within a few days, my head was exploding. And I, seriously am a pretty easygoing person, But, you know, this was a person who, when I would say things or other people would say things, they would roll their eyes, or I would, you know, rounds would go a little longer than I'd like. I usually like to let them out in time for lunch, and they would stop me and say, okay, we've got to leave, you know, for lunch right now, even though we were just finishing up with the patient. Or, you know, a multitude of things that were going on that were making me insane, to the point where I was coming home to my husband and, you know, doing this at home, which was not my usual, to vent over people who I worked with. So I realized at some point that I had to give feedback, and our department mandates that we give mid-month and end of the month feedback, which is actually a good thing. And I'm going to hopefully press you today to be giving feedback far more frequently than that. But in this particular case, I knew I had to give feedback. And so I was really petrified because I didn't know how to approach this. And I was really concerned that, you know, this person might get really mad at me, or might take it out on me in my own evaluations. And so I really grappled with this for a while. And I'm going to leave the punchline of what I did until the end of this talk. And so then you can see sort of how this worked out. Now, whether you know it or not, you're giving and receiving feedback all the time. You know, we think of it more as verbal feedback, you know, saying to somebody, you know, oh, I need to give you feedback. I need to tell you something. But really, you know, that eye roll that your sibling gives you, or your spouse, you know, being a little more brusque with their kiss in the morning because they're mad at whatever you did the night before, or your stomach growling because you forgot to eat. All of those things are feedback. And so we're recipients of feedback all the time. And we actually are giving feedback whether we know it or not. You know, we all know those people who their faces tell the entire story. I can tell what my sister thinks immediately, whether she tells me or not, you know, from her tone of voice or her face. And so all of the things we're going to talk about today are not only good for our learning environment, for those of us who are teaching, but also for your everyday life with your significant others and, you know, other members of your family and friend circle. Now, when you hear this term, you know, I want to give you some feedback, and really what we found is that people don't do this very often. And so there are even institutions where people hold up a card that says, I'm giving you feedback now, sort of like I think I'm teaching all the time on the wards. And unless I say I'm actually teaching you now, sometimes it, you know, goes off their radar. But when someone says, I want to give you some feedback, usually it inspires this look or this fear within you, right? You're like, oh no, because we construe feedback as being negative. And I want to change that thought process in your head as well. We're going to talk about the power of positive feedback as part of this talk. But this is what we usually think of. You know, when somebody says, I want to give you feedback, it's usually because they're going to take the time because something is wrong, right? And so it immediately makes your blood pressure go up and makes you tachycardic, and you're really nervous about what they're about to say. And we're going to try to change that as the givers of feedback. We don't want to inspire that in our learners. So the first thing we need to do is really have a common definition. And when we talk about feedback in medical education, there are several elements. The first is that it's the process by which we as the educators collect data by observation, and it's best by firsthand observation. Sometimes those of us who are in especially leadership positions where you will get feedback from a teacher about a learner or from somebody about a colleague, and that you have to be the person to give the feedback. It's not always able to be done firsthand, but ideally it's done by direct observation. And you have to compare their performance, usually the learner in this case, to a standard. So you have to know what a first-year medical student is capable of doing versus a third-year medical student versus a third-year resident or a fellow. And then you provide them information. And this is the biggest, most important part of this entire definition. It's for the purpose of improving their performance. And if you keep that in mind, if you keep the idea that this is for the purpose of improving someone's performance at what they do, you will always be doing the right thing. Okay, and we want to keep that in mind as we're going through. So the first thing you want to think about as you go through that definition is this feedback. Facebook, is notorious. We look for the likes, right? You post pictures of your children and, all of your friends and other random people, give you these thumbs up or these hearts. Do you really need that? I mean, your kids are cute. You're happy about your vacation. Do you really need, it gives you that shot of adrenaline, that shot of like, oh, yay, they like me. But really, that's all it does, right? So is that truly feedback? And on the flip side of that, does someone saying you suck really help you get better at what you do. And that's the thing that you also want to think about is it helping you with your performance? And this really doesn't, right? When you look at the way that we receive feedback, and I have been the recipient of several of these comments in my career. I mean, how many people, we'll talk about the negative feedback, in a second, but effective feedback has to, again, improve your performance. So it's great that we write wonderful things about our learners who we love and who are extremely capable and say that they're an excellent resident and that they're great with patients and that they're very professional. But what does that tell them that they can take with them in the future to be better at what they do? Why are they excellent? What makes them so professional? What is so great about their interaction with patients? We don't really say that when we just put these wonderful, compliments that we're giving them, which is not true feedback. Again, when you're looking from what we think of as negative, as the constructive element of feedback, if I got one more needs to read more when I was in medical school, I thought my head was going to explode. What does that tell me? Of course, I needed to read more. I could barely sleep and eat, though, at the time. So, reading more was something that was helpful for someone to tell me, but really didn't tell me how that was going to help me in the future. When someone's disorganized, how are they disorganized? What do they need to do when they're working on their presentations? We need to think about how we give really meaty feedback to our learners so that they can take it with them in the future and be better at what they do. So there are these two professors at Harvard who are experts on negotiation, and they published this book that's listed at the bottom here. And they talk about three different types of feedback. One is appreciation, and this is, again, where we thank somebody for what they're doing. Those wonderful comments of, you did a great job, which again is that little shot of adrenaline, but it, makes you feel good for a second, but really doesn't help you in the future. And then there's evaluation, which we're all very familiar with, which is when you're scoring someone against expectations. This is the grade you get in a class, or this is the end of rotation evaluation that we do, that our programs mandate that we fill out. But the thing we're going to focus on today, and the thing that I find is the most impactful for our learners to get better at what they do, is coaching in the form of formative feedback. And we're going to compare and contrast formative feedback and summative feedback now. So I'm going to start with summative feedback. And summative is, again, that grade, that end of rotation analysis. And this is a judgment call. This is saying, did this person live up to my expectation for what a third-year resident is supposed to be able to accomplish? And did they meet the set standards that we think that they should? And it provides the outcome for a specific period of time. Some of you may only work with a learner for a day or a shift. Some of you may work with a learner for a couple of weeks or a month or over a longitudinal period of time. And you're giving sort of that grade at the end of what they're doing. The problem is this is often the only thing that we do for our learners. And so if we don't ever give formative feedback or feedback on the fly during the time period that you're working with that learner, then we're sometimes just doing a flyby at the end and lambasting them or giving them kudos that they never really knew about during the time period and didn't allow them the chance to improve on their performance, especially when we write negative commentary in our summative statements. It's fair to our learners because they don't have the chance to get. And that's why I want you to push you today to become more comfortable with formative feedback. This is information. It's not judgmental. It's just what you see and what you objectively observe during the course of the experience. And it describes a specific performance, not a global assessment of you're lazy or you're disorganized, or what did you see and what can we do about it to guide future performance. And the most important part of this is that it allows for improvement. And one of the things that I find most impactful in my summative statements now for students and for residents is I can say, we talked about their presentation skills and they took the feedback and ran with it and were phenomenal by the end of the rotation. That's good when you're applying to residency as well, that someone takes feedback well and that they actually apply it and are able to improve on their performance even within a short period of time. So there is literature to support why we should be giving feedback. It is essential to learning. Number one, we've shown that effective feedback, and it has to be effective, we're going to talk about how to be effective, has a positive impact on our development of our learners. It helps with knowledge base. It helps with technical skill, especially those of us who are in procedural areas of expertise or surgical areas of expertise specifically. It has been definitely shown to improve by giving feedback. And it doesn't mean, again, negative commentary. It can be constructive or just tweaking something that's being done well but could be done even better. And the one thing that has been borne out as well is that compliments don't improve technical skill. It's great, again, to hear you're doing a great job, but that in itself does not improve your skill. And people actually respond better when they're told that they're not doing something exactly perfectly and that they need to do it a little bit better in a supportive way. We're going to talk about how to do that. Now, unfortunately, our learners specifically are not happy about how frequently we do this and on the quality of our feedback. So our clinical trainees feel that we don't do it enough and that what we're saying is not meaty enough. Again, we are saying good job or bad job, but we're not saying why. And so they're dissatisfied. Residents in general don't find it useful in most cases unless we do it well. And they don't really take it seriously because we're not specific enough in what we say. We don't really have performance standards. So we don't say, you know, at this stage, you should be accomplishing this and then say whether they're doing so or not. We're not doing it in a timely fashion. I'm notorious for this. Unfortunately, I have alerts that are popping up every day now telling me that I'm behind I was on service every 2 weeks for the past several months and I'm behind. And so if they don't get feedback in a timely manner, it often loses its power. And really, they don't feel that they're being observed enough. For instance, medical students, almost all of their grade comes from their presentation skills, which is totally unfair. But it's the only time that they have the center stage in front of our our attendings and our residents, where they have, they get the entire our entire focus. And so there's no ability for us to really say much about their performance other than whether they can present a patient or not. So none of this is great, and we need to change how we're doing things. Even our fellows want feedback. These are true quotes from another residency program in our Emory system, and they're asking for predefined feedback. And the reason is that one of the things I would love for us to come out of today doing is feeling that feedback is part of what we do every day. That, if I only have feedback given mid-month and at the end of the month, it inspires fear in my learners because they know it's coming and they're afraid of what I'm going to say. But if I'm constantly letting them know how they're doing, there's no surprises. And so having defined feedback times, if in some cases programs have done feedback Friday, they know Friday is feedback day. And so there's no fear in the future because you just know that it's coming and you can review what you do well and what you don't do well, and you're going to get better. And that's the way it goes. And so if you set that culture of feedback, it takes that fear factor away, both for the giver and the recipient. So this is the interactive part. I would love for you in the chat box, and Martha's going to help me man this. Let me know, what are the benefits of giving feedback? For those of us who have to provide feedback to our learners, specifically in our educational environments, why is it good that we do so? And Martha, you can tell me if anybody writes anything down. You're muted, Martha. There you go.
I don't see anything yet.
Okay.
However, so being a fellowship program director, I think—
Tell me why it's good to give feedback.
Yeah, so hopefully we set expectations to start with. And if we want to see people meet our expectations, then we have to let them know how they're doing along the way.
Yeah, absolutely. So it helps you get better trainees, right? So it's, you want your trainees to perform at a certain level. What I realized, a little bit into my stint as an attending was that I was relying on a lot of the skills of my learners in order to base my clinical judgment. I don't go in and do an entire history and physical on every single patient. I'm relying on them to be good at what they're doing. I know that I'm teaching the clinical skills to the medical students, so I'm hoping they've got that down. But, sometimes I'm relying on things that aren't necessarily founded. And so you want them to be as good as they can be, not only for us, but obviously for their patients, more importantly. And, one day they might be taking care of us, so it's important to train them well. but there are a lot of benefits of giving feedback. If you don't have a lot for giving, what about receiving? What are some benefits of receiving feedback?
There are some quite a few responses in the chat.
Great. Okay, tell me.
Dr. Bradley says to improve performance.
Excellent.
Dr. Allen says helps me to understand the performance standards and get a discussion going on them.
Good.
We've got development of learner. It creates an environment of trust.
Excellent.
Feedback, as you have defined, will improve the overall performance of the individual and the team. To help people improve and learn, and helps to understand the performance standards and start a discussion on those standards with the learners. Giving feedback opens up discussion of systems and process issues.
That's perfect. And a lot of you mentioned, I love when you said it not only helps the learner, but it helps the team. You know, it makes everyone function at a higher level, which is really wonderful. So that's what, any for receiving feedback?
Not yet.
Okay. So I'm gonna, so for giving feedback, you know.
One comment, receiving feedback allows for improvement.
Yes, exactly. So you get better at what you do, right? So even those of us who have been in clinical practice or in education for a long period of time, I like it when my colleagues tell me, you know, how I'm doing and if there's anything I can do a little bit better. It's hard. It's hard for your ego to hear that sometimes, but it's extremely helpful. So from a giving standpoint, it helps you address issues or reinforce behaviors in real time. It makes your life easier, as someone mentioned. You know, it makes the whole team better. And really from a system standpoint, it avoids kicking the problem down the road. And what I mean by that is, those of us who have ever served on Progress and Promotion Committee or any of these committees, you know, for residency programs or fellowships, when you bring up a problem learner sometimes, you will think you're the only one who's ever experienced this. And then what you find is people will say, oh yeah, that happened to me too. But no one ever said anything. Nobody documented it. Nobody gave that person feedback on how they did. And this is sort of the story of what happened with the learner that I'm going to discuss, that I already mentioned that I'm going to discuss later as well. And it causes a problem not only for you, it causes a problem for the program, it causes a problem for the system. So you want to make sure that you are giving appropriate feedback in order to help that learner, most importantly, but to also help their future patients and the program in general. As a recipient, it helps you learn and grow. You know, anytime you get feedback, you have to think of the idea that this is the goal to improve. And again, it's hard for us as type A, you know, very successful people to hear that we're not perfect. But we can always get better at what we do, and it makes us more resilient as well. And so when you get feedback in the future, it's less stressful to do so. And you learn something about yourself that maybe you didn't recognize. And so receiving feedback can be very powerful as well. Now, we know it's important. The literature says that we should be doing it and that, you know, our learners want it. What's so difficult about doing it? Why don't we do it? This is another interactive part, by the way.
I don't see, let's see. Oh, because the ego is hit and there are emotional reactions to feedback.
Okay.
Someone else said it's painful to cause pain. Yes, Dr. Waller.
It is. We hate being, you know, it's like shoot the messenger. We don't want to be the messenger.
Yeah, and then giving positive feedback is easy, but anything not positive is very challenging.
Exactly right. So you hit it right on the head, right? So the first thing is that that you need standards of competence, and you have to know what you're comparing them to. So you need to know, again, what a medical student's capability is versus a resident versus a fellow. Nobody mentioned the four-letter word, which is time. You know, oftentimes we think, oh God, it takes so much time to give feedback for our learners, and we really can't, you know, take the time out of my day. My God, I mean, when I had to do end of month feedback just recently, it was really difficult to find a place in Grady to sit down and give them private feedback, and then to sit there and, you know, take the end of my day when I was wrapping up my service to do this. But it really doesn't take, for this type of feedback, formative feedback, it can be done where you're double counting. And I'm going to show you how to do that. as somebody mentioned, we don't like hurting people. We went into medicine to help people, to make people feel good, right? And we don't want to hurt people's feelings or to hurt their careers, God forbid, if we document something. And then worst case, there's retribution. You know, they evaluate us the same way we evaluate them. And it hurts to be told that you're not doing well either if you're the teacher. So we don't want to damage that relationship. We're in a longitudinal program, right? I have to see the medical students all the time. You know, you have to see your residents and fellows. So it leads to this thing that we call vanishing feedback, that ND, who's one of the researchers on feedback, determines, he called it vanishing feedback. And vanishing feedback is where we just don't do it, right? We sit there and we go, I could do this. It's really hard. It's a little scary. I don't think it's not going to feel good. I think I'll just go over here. And so we don't want that to happen, because it doesn't help our learners be better at what they do. And it doesn't help the recipients of the feedback get better for their future and become people who are good at giving feedback. And so we don't want to succumb to vanishing feedback. So the thing that I want you to think about today is to redefine yourself as a coach. That noise you're hearing behind me is my new Labradoodle puppy crunching on something. So I apologize for that if you hear that. So you're going to redefine yourself as a coach. And this is Rick Barnes. He is the coach of the University of Tennessee basketball team. My husband went to the University of Tennessee. We have a lot of orange in our house. And he became the UT basketball coach in 2015. And at that time, Tennessee's record was 16 wins and 19 losses. But by the 2018-2019 season, to my two redheaded sons' great pleasure, they were 31-6. They were ranked #1 for over a month in the country, so they could walk around happy in Georgia and Florida territory that Tennessee was, winning. And, they went to the Sweet 16. And it was really due to Coach Barnes and to his mentality and how he approached things. And because of his leadership, he was actually recognized as SEC Coach of the Year. He was runner-up for the National Coach of the Year. More importantly, his players were better at what they did. And actually people like Grant Williams, who's one of his star players, is now in the NBA and went in the first round. So really our goal is not to just get kudos ourselves for what we do, but more importantly, to make our learners better. So for those of you who have been coaches or who have been players, how do good coaches make their players and then ultimately their team better?
Someone says motivational speaking, motivational talking, and to inspire improvement of the entire team.
Awesome. That's exactly right.
Paying attention to each player, constant feedback on how to improve, and allow them to see their own solutions to problems.
Excellent.
Skills improvement, master the fundamentals, encourage teamwork.
That's awesome. And that's exactly right. And those are the exact same things that we can apply to the medical environment. Even though it sounds completely different, coaching a basketball team in the SEC versus what we do in medicine, it's exactly the same. So the coach knows their team and their players. And one of the things that I found really, really helpful on my ward teams especially, and definitely in my small group, which is a longitudinal experience where I know them from day one to graduation, is getting to know your team and your players, getting to know their individual skills that they want to work on, the things that they excel at, and how they work together as a team. When I'm on service, I actually ask in the first couple of days, tell me what it is that you want to work on, so that they know they're going to get feedback on those things, and that takes away some of the fear factor. And it tells me that they have insight into what they feel that they need to improve. The coach does focus on essentials. You can't teach somebody to do, a fancy schmancy dunk where, you're going up in midair and doing a Michael Jordan, dunk that's immortalized forever if you don't know how to dribble across, the court. So focusing on essentials is what we do as well. I need to know if my students know how to listen to the heart appropriately before I can know that they can actually identify a murmur. You have to demonstrate those skills. You have to show them what you want. You know, we are role models. And so we want to role model our desired behavior, and that's what coaches do. And we want to be supportive in what we do. That doesn't mean that, you know, last night watching the opening game, Tennessee won, but they didn't win handily, and Barnes was mad. You know, we don't want to do that. We don't want to yell at our learners. You want to be supportive, but you want to be forceful and say, you know, hey, this is what I expect, and set expectations for your learners. But you're going to do that by motivating that and by inspiring them to be the best that they can be. And the other thing that's very important is that we're identifying where they need to go. You know, you being where you are in your training process as their learner knows that where they need to go next. And that's the hardest thing. You know, they know where they are, but they don't need to know what they need to know. And so that's where you come in. And then we need to provide repetitive practice and keep telling them how they're doing and tweaking what they're doing in order to make them better. So all of these coaching elements apply exactly to our environment as well. Excuse me. So many of you may be familiar with the classic feedback sandwich, and not to besmirch the good old turkey sandwich or the PB&J, but there are some drawbacks to the feedback sandwich. Anybody who's given this or, you know, God forbid, been the recipient of this, knows that it was created to try to buffer what was really the meat of what they were trying to do, which is the constructive feedback, right? So they give you the positive, oh, you're doing such a great job. And then the constructive stuff, which is really what they're trying to tell you. And then, oh, but you're doing such a great job. And the reason that was done is because, again, we don't like being negative. We don't like being the deliverer of bad news. And so it's very hard to do this for our learners, right? It's very hard to buffer it because sometimes all they hear is the good stuff. Dr. Bernstein thinks I'm fabulous, and they miss the whole crux of what I was trying to do in the first place. Or they only hear the negative and the positive was lost anyway. And they think, oh, Dr. Bernstein hates me. She told me that I'm not great at everything. So this is really not the best way to approach feedback. So I'm going to be a proponent for sort of the gourmet sandwich instead. And this is the ask, tell, ask. We're going to go through this individually, but basically you start by having your learner self-assess. And by having them be an active participant in the feedback, it lessens the one-way negativity that they're going to perceive. And it's going to help them partner with you to figure out how best to approach whatever it is that you want them to improve on. And then the tell is to work together on what you want to do and to tell them what you've observed. And then the final ask is to wrap up and to follow up. And so we're going to go through each of these. So the first ask is self-assessment. And one of the things I like to say is, hey, where do you feel good? Where is it that you think you're doing really well at this point? Where are they most successful? And then what are some areas where you feel you can work? And again, because I've gotten to know them, if I just come in as an outsider, they have no idea who I am and I'm just this scary attending, then they're not going to really want to open up to me. But if I've built that relationship with them over the first several days of the rotation or of, you know, small group, where I've gotten to know them and know them as people, and I actually find out about, you know, are they the only doctor in their family, and, you know, who's their support system and things like that, so that they realize I care about them more as a person as well, not just as, you know, the worker bee on my team. And so then when we have these conversations, it's more of a coaching style, right? So how can they expand their knowledge, or how can they get better at whatever it is that they want to get better at? And what is it that they think needs to change? And so it does several things. It's the same way that we have learners give us, you know, where we assess learners on their knowledge base. You know, we find out, for instance, with my medical students or residents, are they starting on hypertension with, you know, I know everything about hypertension and I did research in it, in which case I need to start my conversation differently, or what is hypertension, right? So here, the same thing. Do they have insight into what you are seeing, or are they completely off the mark? And really, as we all know, the hardest people to give feedback to are the people who are overconfident and undercompetent. And not to say that, you know, when we use undercompetent, they're probably extremely competent, but in that particular area, they might not be up to the standard that you want. And those are the hardest because they think that they're all that in a bag of chips, but they're not necessarily. And it's really hard to get through to that person. And that was sort of the learner that I had, who I had on my ward service. So a self-assessment is key to doing what you're going to need to do. Then with the tell, it's really important. Number one, it should be expected. I'm going to give you feedback. Do you have time, you know, later today? Or, hey, I'd like to give you feedback. If it's something minute, if it's something major, you want to give them time to sort of process that you're going to give them feedback. And you want to do it in an appropriate setting. We're going to talk about positive feedback and how that can be done in a public environment, but really constructive feedback should not be done in front of the nurse's station, should not be done in front of their colleagues. It should be done in a private environment, not only to help them save face, but also because it allows you a private conversation where you can really work on these things. So in your office or in a private room in the hospital, wherever you can find. And it should be limited. You know, ideally, there's only one or two things you need them to work on. Sometimes we have learners who there's just a multitude of things you could focus on. And really what I would suggest to you is find the thing that's going to be most impactful for them, for their patients, and for you. You know, if efficiency is keeping you up at midnight signing their charts and they're at the hospital all night long and they're not getting their, you know, consults in or whatever's happening, maybe that's where you want to start. So limited in scope to the things that are going to be the biggest bang for the buck. Base it ideally on what you've directly observed if you can, and limit it to stuff that's fixable. If it's not fixable, if it's a personality, not the manifestation of that personality, but if it's a personality issue or, you know, something that is just not fixable, then you can't fix it. So find something that you can fix, whether it's an expression of that, the way that they're talking to people or whatever it is, that's what you need to do. And you want to try to be as even keeled, as non-judgmental as possible. And it's very difficult. You need to, you know, the same way when we talk to our significant others or to our children, and we don't want to sit there and say, you know, you're lazy. We want to say why we perceive that and don't use that term. You know, when we say you're, you know, a slob, you don't want to say you're a slob. You want to say, hey, you know, you've got a coffee stain on your jacket. Can you tell me what happened? Oh, I was in an accident on the way to work today and I didn't have time to go home. Okay, so now I understand and I'm not going to make judgment calls on this person. So make sure you're not being, you're not imposing your judgment on what you think. And one of the things you can do is follow this mnemonic, which is to relate, explore, partner, and plan. So the first thing is to think about, if I was the recipient of this, how would I react? And so I want to hear the words that I would want to hear. I want to say those words that I would want to hear. And then you want to explore how they respond. This is sort of, we just taught our students how to deliver difficult news, which I know as part of Winship, you guys have to do more than most. And really sitting there and letting them process, you know, I've noticed that, and then see what their reaction is. Some of them may say, yeah, you know, you're right. And some of them may say, you know, I don't really think that. And see where they are so that you can match where they are and respond appropriately. And one of the things that's most powerful is to identify a shared goal. And one of the best shared goals is, you want to be good at this, and I want you to be good at this. You know, I want you to be the best oncologist that you can be. You know, I want you to be the best teacher you can be. I want you to be the best, you know, proceduralist, whatever it is. You know, helping them get there. It's a shared goal. That's what they want, right? So it's not just you saying you're not doing a good job. That's not what you're saying. What you're saying is, I want you to be the best you can be the same way you do, and let's see how we can help you get there. And so then that plan is very important. And that's where you focus on together what it is that they're doing that they think they should perpetuate, what it is that they're doing that maybe they can change, and then what it is that you can follow up on. And that is the most powerful piece of this whole thing, which is that if I say to a student, hey, you know, your presentations are a little meandering and they sort of go off on a tangent, and I, you know, let me tell you some pointers of how to make them more, you know, tighter and a little more straightforward so that it, you know, you're more effective at doing this. And then they do that. The most powerful thing is to say, you know what, I just noticed that you took my feedback and that was amazing. And I'm going to tell you why it was amazing, because you were, you know, you focused on the chronology of what was going on. And I give them specifics as to what I liked. And that way they perpetuate those things again. They feel good about the fact that I noticed that they actually took my feedback and ran with it, and they will keep doing that. So follow up is, don't underestimate the power of follow up. And then the last thing is the second ask, which is the wrap up. And that's almost like a teach back, you know, so tell me what you understand from what we've talked about here. And tell me when we should follow up, and you know, again, this is sort of encompassing the follow-up from the slide before as well. So there's also an R2c2 model. This is very similar, just in case any of you have heard of this before. It's really facilitated feedback in residency education. It was published in MedEd Portal, and it basically does the same thing that the ask, tell, ask that I just mentioned. So you build a relationship, you explore their reactions, you explore their understanding of what you just told them, and then you coach for performance change. So some people use this model as well. They're the same thing, basically. There are some advanced concepts to feedback that I wanted to mention as well. One of them is called frame-based feedback. And frame-based feedback is, you know what they did, but we assume a lot of times why they did what they did. And so you know what they say about if you assume, right? It makes out of you and me. So we don't want to assume anything. And this actually was published in an article where it was surgery and anesthesia residents at Harvard. And there was a surgeon who was tentative in the operating room. And the attending's perception was that that resident was tentative because they didn't have enough expertise in the operating room. And so they turned to the learner or to the trainee and said, you know what, you need more time in the OR. You know, I noticed that you were a little hesitant as you were, you know, using the scalpel, and I want to make sure that you are more confident. So we're just going to get you more cases. Well, that was totally the wrong prescription, because the reality was, if they had just asked the trainee had pulled an all-nighter on call and then had to work the next day and was worried about being too tired and hurting somebody and making a mistake. And so they were tentative in that particular instance because they were overworked, not because they had too few cases. And so if we assume the thought processes that drive the actions, we're doing the wrong thing. So ask. And that's the most important thing, is to say, tell me what's going on. And I will tell you that there have been so many times that I've said to somebody, I'm noticing this, and they were floored that I noticed. And then they opened up to me that their parent was in hospice, or they were going through a divorce, or their car had been broken into the night before and they were just scattered. Whatever it was that I would never have known otherwise if I didn't ask. And it framed for me whether I needed to then, you know, really focus on the feedback or on supporting that learner in the environment we were in because of the stress that was added in our workload. So frame-based feedback is really, really important. The other thing is to think about what phase of learner you have. So medical students and even interns want you to be more directive. Medical students just want to make you happy. They just want to do well on the rotation. If you could tell them just how to make an A, they would be so appreciative of you. You know, tell me that I'm doing a good job and I will do anything you say. You know, they are sponges for whatever it is you want to teach them, which is such a wonderful thing. And they want directive feedback. Hey, if you could be more efficient with your presentations, that would be awesome. And they will do it. Your fellows and faculty, our peers, we need to be more facilitative, right? They are good at what they do. You just need to tweak them. You know, there's a lot of literature out there, even about people who are at the, you know, at the top echelons of their craft, who ask for mentors to help tweak what they do because they want to be even better. And so being directive at that level is not going to be received well, and it's not going to give them what they need because they're already pretty autonomous. We just need to help them get better. Not to say that some things don't need a little more directed feedback, but, you know, be choosy in the way you do it. Don't underestimate the power of positive feedback. You know, positive feedback is actually something that I highly suggest you do in a public environment. So when I was talking about double counting and the time that it takes to give feedback, you know, yes, when you're giving constructive feedback, you need to do it in a private environment in a time set aside. But positive feedback, oftentimes I'll be on rounds and I'll notice my resident doing something that I want not only for them to perpetuate, but I want to recognize them for, and I want really the rest of the team to learn from. And so we'll walk out of the room and I'll say, you know what, I really loved how you crouched down at the bedside and made sure you made eye contact because that patient couldn't sit up, and you know, instead of sort of, you know, standing over them in a position that would have been uncomfortable for them and for you, you know, being able to sit there and show empathy and really develop that connection with them was so powerful. And so I'm telling them exactly what I liked, and everybody else is hearing it. And so they go, oh, Dr. Bernstein likes it when I'm empathic and when I, you know, I'm you know, paying attention and being patient-centered. And that's really a powerful thing, is to do that in front of the entire group. It also makes that person feel good. I mean, we said we like that shot of adrenaline. We like being told that we do good things. And the problem about feedback is, again, we construe it as negative. We get that feeling when somebody says, I want to give you feedback. Well, make feedback both. Say, I'm going to give you some feedback, and then make it positive. There have been so many times that I've been in a restaurant. I haven't been in a restaurant in about 8 or 9 months, but when I used to go to a restaurant where I would say to the server, could you please have your manager come over? And the manager and the server would come over, and usually I'll tell the server it's because of good things, but the manager will come over and they look like they're panic stricken, that they are going to vomit, and I say to them, hey, I just want to tell you that, this person was fabulous and this is why. And you see the sigh of relief that happens. We don't do it enough. We don't give enough positive feedback. So do this not only for their own sense of accomplishment, but to help the rest of your team be better at what they're doing. Be specific about it. And if you can give positive feedback on what is meaningful to that person. So again, going back to the fact that I've learned from my mentors that to ask at the beginning of a rotation, tell me what it is that you want to work on, or what it is that you feel that you're particularly good at. And then notice those things. You told me that you were having trouble with, relating to a patient, but I want to tell you, I just saw that, and that was a thing of beauty. You did a great job because of this, this, and this. That's meaningful to them, and that's going to make the biggest impact. And so don't forget the power of positive feedback. There's also power to peer feedback. And this is one of the hardest things to do. Those of us, again, who are in leadership positions where we have to give feedback to people who teach our courses or who are our attendings on service, and you've gotten some potential constructive commentary on. It's very hard, but we can learn from each other, and we can get better at providing feedback by receiving feedback. Because once you've been in the hot seat of receiving, how you want to give feedback. You want to make sure that you have direct evidence, whether it's your direct observation or whether it is from another colleague, that that it's grounded in truth. And the best way to start is to approach from a perspective of curiosity. I noticed that there was some tension between you and the nurse at the nurse's station. Was everything okay? And just ask in a general fashion, as opposed to, you were yelling at the nurse and I thought that was so inappropriate, and you're doing it in front of their learners, which is going to embarrass them, and we don't ever want to do that. So approaching from a perspective of curiosity and starting open-ended so that you can see really what the story is going to give you a better grasp of the true nature of the problem. And then share any information or suggestions, and you have to, again, be non-judgmental. You have to handle your emotions. The things that we would do if our sibling or our significant other said to us, and the ire or the fear or the emotion that would rise up, we can't do with patients and we can't do with our peers. So it's important to do this, especially when it is impacting the learning environment or impacting the clinical environment. We have to step up. We can't be victims of vanishing feedback in that case. We have to do this, but to do it in an open-ended way, and to do it in an inquisitive fashion, to say, hey, what was going on, may give you more information and know how to approach the situation. So I'm going to wrap up here, and then we'll open up for questions. Effective feedback is given to improve learner performance. It should be expected, and if it's expected, then it's going to be less fearful or fear-inducing. It should be well-timed, proximal to an event if possible, but if something is heated, if you were in a code or if you were in, a bad situation, to do it right then may not be a good idea, because you may have heated emotions or the learner may have heated emotions. So giving a little time to process and then, talking about it, but you don't want it to be 2 weeks later. I always joked that my older son, when he was younger, occasionally we'd get some feedback from the teacher about his behavior at school. And by the time he got home, I'd say, I heard you had some difficulty at school. And he was like, I was at school today? Because, to a 4-year-old, 8 hours was like a lifetime, so make sure it's well-timed, be specific, make it limited. If there's so much to deal with, make it something that's best bang for the buck. And then try to use the coaching and the ask, tell, ask approach, because that's going to give you more of a partnership in finding an answer to the problems that you're noticing, as opposed to just a one-way directive approach that may not work as well with your learner. So going back to my real life dilemma, I had this learner who, again, was perceived as, being really not a great doctor. I mean, in all of his evaluations, people had lambasted him. And on my service, what I realized was he wasn't a bad doctor. He was actually a really good doctor. He just was a very abrasive personality. And, again, I pride myself on being able to get along with almost anybody. And I was having trouble. So I knew that if I was, probably other people were too. And so I was at Publix and I called one of my very close friends who is good at this, Kimberly Manning. And this was years and years and years ago. And I said, what do I do? And she talked me down from the ledge because I was really worried about confronting this person. And we went into a private, area and I started talking to him and said, how do you think things are going? And he really had no concept, or he was guarded and didn't, perceive that there was a problem. And I just had to be very straightforward and say, look, what I decided to do was I realized was that he was a really, really smart guy and he was a very capable guy. And what I said to him, which was the God's honest truth, I wasn't just stroking his ego, was, this is the reality. You're a good doctor and you really could have been chief because you are so smart at what you do and you're so, you're a good teacher, but you are, I have noticed that, at times you roll your eyes and at times, you're a little abrupt with me or with the other people on the team. And really the reason I decided to confront him was it came to head over patient care at some point where he didn't want to do something that I thought was appropriate. And at that point, which was hard for me because I was a new attending, I sort of, said, no, we're going to do this. And he listened to me and I said, okay, he's either going to punch me or, and he didn't, he looked at me and he listened and he said, okay, thanks. I really appreciate that. And I wasn't sure how it went. And subsequently, number one, a few weeks later, so this patient, it turned out, was at the end of life and had ascites, and he didn't want to send this patient for another scan. And we tapped the patient and scanned him, and we actually got him back to his estranged family, and he died in peace with his family. And so the family at Grady, which never happens, sent a basket to my team, thanking them for the care that we gave the patient. So he came to me and found me and thanked me for the feedback I had given to him, for that realization. But subsequently, he asked me for a letter. He applied to a different residency afterwards, did a double residency, asked me for a letter of recommendation, and told me that I was the only person who ever told him what the real problem was. Everyone else in his feedback, which was really evaluation, it wasn't feedback. No one had ever given him formative feedback. They just, and on our evaluations, there's no way to really capture a personality issue or a manifestation of that personality. It's really more, are they a good doctor or are they a bad doctor? And so everybody's perception was he was a bad doctor. He wasn't a bad doctor. And I was the first person who validated that he was a really good physician. He just was not, he just was very, his personality, the manifestation of that was a problem. So flash forward, this was probably 15, 20 years ago when this happened. 5 years ago, I got an email out of the blue from him and he said to me, I just want you to know, and I hadn't heard from this person since he graduated. And he said, I want you to know that I'm now in academic medicine. And I've been reflecting and I realized how incredibly difficult that must have been for you. And I never told him how hard it was. And I never, I thought I was being all cool and, didn't, give that perception. But he said, I want you to realize I realized how difficult it probably was for you and that I'm in that position now. And I am taking the lessons that I learned, of how to do this well from you. And I literally burst into tears because it was one of those validations, we work so hard and we teach and we take care of patients. And every once in a while you get those little nuggets of, wow, I did a good job. And so his feedback was really, was very heartfelt and completely out of the blue. And so our learners would like this, they benefit from it and they realize it. And so we should be doing this more, and hopefully we can step up and help them in this way. So if we create a culture of feedback where we do this frequently and we take the fear factor out of it and we do it in a coaching vein, it helps not only our learners and our patients, but it helps the entire system. Incorporate it into your routine, just feedback on the fly. Hey, next time let's, try to do it this way, if you can, because of this, this, and this, give them specifics and then move on. Think of it as individualized coaching and share that common goal. You want to be the best at what you can be. I want that too for you. Let's figure out how to get there. Don't make assumptions. Use that frame-based feedback and don't underestimate the power of positive feedback. So I want you to think as you leave today, what is one change that you're going to make in giving feedback to your learners, to your significant other, to your children, to your pet, whatever it is that you can take from today that will help you. And I'm happy to answer any questions. Thank you all for having me here today.
Lisa, thank you so much. That was a great, incredibly specific presentation. So I think, so there's some questions. So if you have any questions or comments, use the Q&A. I'm also looking at the chat box.
So I've got the Q&A up.
Okay.
So how can you as the potential recipient help elicit good feedback from the person who should be giving you good feedback? So this is a great question. So if you are the actual recipient, you could initiate the conversation. This is hard because you're opening yourself up. This is why people don't do this, is because we're fearful of opening it up and saying, hey, I'd like feedback. And then they go, okay, well, then let me tell you what I think. And we like being shielded from that. But I love that you want to elicit feedback. Now, the problem is, this says elicit good feedback from the person who should be giving feedback. When we say good feedback, hopefully you mean constructive and powerful feedback rather than just good. Hopefully we're hearing good things too. But what I would say is, hey, Dr. Bernstein, we're going to be working together. I want to be really good at, delivering difficult news to a patient, or I want to be whatever it is that you want feedback on. I would love it if you could help me with that while we're working together. I am the course director for clinical skills. So oftentimes when I ask my learners, and I initiate it because this is something I'm passionate about, but you can absolutely as the recipient initiate this. And oftentimes what they'll say to me is, I really want to work on my physical exam. Well, because they know who I am, or they heard through the grapevine. So that's what they'll ask me. But anything you want feedback on, absolutely. There's nothing that a teacher likes better than somebody who wants to learn and who wants to better themselves. So that will put them in good graces put you in good graces in their eyes as well. So I think that's a great idea, and nothing wrong with asking. The chat box, let's see, I don't see any more Q&A. Let's see, anything in the chat box. Thank you, Amy.
I have a question. So do you have any tips on how to improve our timeliness? At least for fellowship, ACGME wants us to be timely with feedback within 2 weeks from the rotation. And you mentioned Feedback Friday, which I like that idea. Any other tips on how to?
So again, the feedback you're describing is evaluation, right? Like our end of rotation evaluations, we have to turn in for, one of the things I do find helpful is I will take notes during the course of a rotation. And when I'm giving formative feedback, I'll keep that on a little note card for each learner. And then that way, when I write my evaluation, it's just easy. Because half the time I get to the end and I've, already done 2 weeks, then I've done another 2 weeks. I'm like, who did I even work with? I can't even remember who these people are. But if I have notes, I can say, oh yeah, I remember when I was with this particular patient with that, learner, and this is what I saw. So when you give your formative feedback, which is what today was, the crux of, make sure that you're taking notes and that you're keeping it, because that makes it so much easier to do the evaluation. And if you think of the domains that they ask us to comment on, they ask us to comment on, patient care, and they ask us to comment on, systems-based practice. And think of those domains when you're coming up with commentary, and just, keep track of it. And then it's easier to fill out at the end.
That's a great idea. Could you briefly give an example of facilitative feedback?
When you say, so be specific as to what you're.
You said you were differentiating how to give feedback to medical students, interns versus.
Oh, you're saying to a fellow or a peer.
Yeah.
So again, allow them to really come up with the solution even more than being directive. For a medical student, I might say, when you're giving a presentation, these are the things I want, right? When you're talking about a fellow or a peer, you can say, this is the issue I've noticed. What do you think would be a good solution, or how can I help you best, do this? It's sort of like in the OR, Atul Gawande actually wrote a phenomenal article about coaching, and how he asked a premier surgeon to help him, and he's a premier surgeon in the OR, and the guy just said, you're holding your arm wrong. If you hold your arm this way, you're going to have much more reach, and you're going to be much more adept at doing what you're doing. And it changed his whole, and he'd been practicing his whole life, a certain way. So I think it's those little tweaky things that we want to do and allowing them to really come up with the solution and then helping them find it if they don't find it themselves.
Great. Thank you so much, Lisa. This was a great session.
Did you want me to, there's somebody who asked a question.
Okay.
What do you do to get to know the learner? Specific questions or general, how much time? I, just talk to them as we're walking between patients, to be honest. Well, so first what I do is when we sit down and talk about, I set the goals. And that's another thing about feedback is if you tell them exactly what you want and what you expect and they don't reach that, they're going to know why you're talking to them. So what I do the very first day of a rotation is I sit down and I say, hey, I'm Lisa Bernstein. This is who I am. These are my kids. This is my dog. I trained here. I did this. And I then find out about them. And, then I ask some, inane question like, what was your COVID guilty pleasure? What TV show have you been watching? So, and just, something that has nothing to do with medicine. And then we talk about the goals for the month and what I expect, and sort of I have a tripartite, good patient care, learning and teaching at all levels, and supporting each other as a team, and those are my 3 things. And then we talk about what their goals are. And I say to them, hey, over the next 2 days, I'm going to ask you what you want to specifically work on. But then as we're walking between patients, I'll say, oh, you went to Notre Dame, what'd you do there? Oh, you were on the on the football team at Notre Dame. Holy cow. And I just get to know them as people, because you're having a lot of time just in transit, and it makes it more entertaining for me. I like knowing who I'm working with, and it personalizes them for me so that they're not just, some nameless, faceless, learner who's doing, the notes that I can sign, So it's fun. It's more fun that way.
There's one other question, good one. Any extra tips about feedback for someone who historically does not handle feedback well in the past?
So again, I think, trying to do it, thank you, Mary Jo, for that, trying to do it in the vein of a coach. I think, again, going back to my personal example with the learner, they had never gotten formative feedback. They have never gotten somebody saying, I care about you and I care about our patients and I want the team to work better. And, looking at the greater good, this is about your performance for your future. I want you to be good at this. I'm invested in you. This is me taking time investing in you. This is not me telling you that you did something wrong, right? And if the perception is that I'm invested in that person and that I really want them to be better, and in turn, it will also help the whole team and our whole working environment and our relationship, then it's a win-win, right? So it's the way that we come toward it. If we allow our emotions, and really, I came from a place of, I really wanted to scream and yell and rant and rave, but I couldn't do that, with this person, and it wouldn't have gone well, obviously, if I had done that. And so to sit there and say, hey, it's not helpful for me when I'm trying to teach and you're rolling your eyes or you're cutting me off, how can I work with you so that I'm going to be more mindful of the time, okay, to be respectful of you, but can you work with me? And we came to sort of a joint agreement of how we were going to act. If that person still does not take feedback well, then you have to elevate it sometimes, because again, it's those people who are unaware of the fact that they're not perfect, that are the most difficult, to deal with.
All right. Well, thank you so much for this wonderful session.
Thank you for having me.
And join us next week for the last grand rounds of 2020. We'll be hearing from Dr. Edith Mitchell, presenting Improving Survival by Continued Disparities in Cancer. Have a great day.
Thank you.